If the words permanent sterilization hit you like a thud, you may be one of thousands of women who wish to reverse tubal ligation, which is a procedure known as tube tying. Now, I will tell you, I was really surprised over the last few years, Serena, to see the number of people on our app who are asking for tubal reversal surgeries.
Wow.
So you all probably know by now, Dr. Serena H. Chen is an IVF specialist out in Northern New Jersey, here to talk about this. So it comes up way more than we would have thought. But then again, you have people get young, married when they're young, and then they have their 2 children. And then 10 years later, they are divorcing and they thought they didn't want any more children, but now they have a new partner who doesn't have any children and they want to have another family.
No, we have a really long reproductive lifespan now. And a lot of people regret having their tubes tied. Like I think the statistic is 15%. It may be even higher if you're under 30. And so the American College of OBGYN actually recommends that, that we seriously think about not doing a tubal ligation under 30 because of such a high rate of regret.
That's really critical. And we have great long-term birth control options that we talked about. So there's been advances in long-term birth control.
Yeah, the
some
IUD
that are even non-hormonal.
used to have such a bad reputation, and a lot of doctors now have changed their mind and find that it's really awesome because there's a lot of different choices. There are some that are more affordable. A lot are covered by insurance. The progesterone releasing ones release very small amounts of progesterone right into the uterus. Very little goes into the rest of your body. So being exposed to hormones is much less of an issue. And the copper one, there's no hormone exposure, but the hormone releasing one has the advantage of it does tend to make your periods a lot lighter. Some people even lose their periods. And they
but
come
is that an advantage? I mean, don't we need to shed our uterine lining though? Like
no, because it just makes it thin, so it doesn't get.
So it doesn't need it. I see.
So you don't have to shed it. It actually keeps it. Some doctors even use it as a method to protect from cancer for people who are prone to endometrial cancer. So it could be a really great option for PCOS patients, say, where they have high blood pressure and they don't want to take birth control pills, or they might have sugar diabetes. They don't want to take oral birth control pills. It could be a nice option. They come in different sizes, so you can even use them in teenagers, people who have never had a baby, where it used to be kind of uncomfortable if you haven't had a baby before, but now these new options just, they're really great. So I feel like people should at least give them a thought.
Right. I understand that completely. I mean, especially when so many people skip a pill, they panic, sort of like why the morning after pill probably was invented. It was the, oh my gosh, I forgot 3 pills and, and now breakthrough ovulation. Yeah. Exactly. And that was the whole point of permanent sterilization is if you were, if you were already coupled up and you're with your monogamous partner, then you just, want to have to not think, which the IUD allows you to have that.
And the failure rate for a properly placed IUD and permanent sterilization actually are kind of similar because they both have a small failure rate.
Sure. So, well, let's talk about what all these different options are, though. When you have a patient that comes to you and wants a tubal reversal, there are other ways to proceed with having a baby that might actually have better success rates with fewer risks.
Yeah. So IVF definitely, if you have access to IVF, it definitely is lower risk. There's, much less anesthesia, much shorter time under anesthesia. It's not really a surgery. Whereas a tubal reversal is at minimum a laparoscopy, which is a major surgery. Sometimes it can mean a big incision depending upon your situation and your surgeon, whereas IVF is just a needle going into the ovaries for 10 minutes and pulling out the egg. So, and now that IVF pregnancy rates are so high, especially if you're over 35, over 40, it may be quicker, easier, faster to go to IVF because a lot of people that get their tubal reversal a lot of times end up needing IVF anyway.
So then let's talk about that a little bit too. So in a tubal reversal, there's going to be scar tissue if you're doing surgery, right?
Yes, it's
So
very, the tubes are very, very delicate, and it is hard to, they're never going to be exactly the same when you put them back, because most of tubal reversals, you have to remove the scar tissue and then you sew them back together with microsurgery, and you're losing a segment of tube, and then you have the suture line, and that potentially causes scarring. So even in the hands of a really good surgeon, you are at increased risk for ectopic pregnancy or tubal pregnancy, which can be very dangerous.
absolutely.
And so the risk of tubal pregnancy is much higher after tubal reversal than for most IVF patients.
Ectopic pregnancy, though, is a small risk in IVF, isn't it?
Yeah, it's about 1%, and usually those only happen in people with things like endometriosis or previous tubal surgery or tubal disease. So people who don't have any of those risk factors, the risk for ectopic tends to be even lower than that, but it's not zero.
It's not zero, which I was surprised by. I mean, when I was going through my treatment, you sort of think, oh, you're putting the embryo in one specific place in the uterus and it's going to stay put.
I know, but we know that the uterus has some peristaltic contraction. So perhaps that's the reason that embryos get pushed into the tube when you have scar tissue in the pelvis.
Got it. Okay. Well, that makes a ton of sense. Now let's talk about cost too. Is a tubal reversal something that insurance usually even covers?
Usually not.
Okay.
So,
yeah.
It can be thousands and thousands of dollars for the surgery, for the physician's fee, for the anesthesia, the OR time.
Right.
But IVF can also be expensive too. And so it's, I think each individual person needs to take a look at their own, like get all the information to figure out what's best for them. I would say over 35, I would lean much more heavily towards IVF. Even younger people, like with IVF, you can do things like test for genetic abnormalities and, all of those kinds of things. So that can be an advantage of IVF. The surgery is more permanent. So it's like once your tubes are open, you can keep trying month after month, which a lot of people like that advantage. So I think if you're younger than 35, and you find a really good surgeon, someone who's very experienced, then that might be a reasonable option. But less and less physicians actually do this type of surgery anymore, because it's just because IVF is so successful. Very few people, like I used to do the surgery, and I just don't do it anymore. And I would not want to take on a patient, because you want somebody who's doing surgeries on a regular basis. It's a big
Well, sure. They're coming to you really because they want to have a baby. And tubal reversal is, of all the options in front of them, no matter what their age, is still the more successful approach.
Right.
And certainly if you add up all the costs and you say, okay, well, I can pay this fee for the surgery to reverse the tubal ligation. But if I do need further treatment, and then you add up all those costs, and I think that the delay cost, that's an emotional cost. It's a kind of time cost. It's sort of a quality of life cost. And I don't think that can be overlooked.
Yeah, I think you're right about that. Yeah.
Those are the delays is something that we don't often talk about, a lot. So I think
I think that patients often look at surgery as you have an issue and you get rid of it. And tubal reversal's not, your tubes are never going to be the same as they were before. You're getting something a little bit different. And, some people are a good candidate, like young. If you had your tubes burnt, then you cannot do a reversal, or we definitely would not recommend it. If you had, part of the tube removed, it's not a good idea. If you've had a previous ectopic tubal pregnancy, it's not a good idea. So there's a lot of things that may make you less than an optimal candidate. So it's very, and it would be nice if you can see somebody who's really good at laparoscopy, because if you can do it laparoscopically, then you don't have to stay in the hospital. That would be a big advantage, but it's hard to find people who are really good at it laparoscopically.
It does seem that there are far more specialists who advertise vasectomy reversals than tubal ligation reversals. That seems to be a little bit easier of a procedure, something that is very promoted in the market.
Yes, that, and I think it is, you know, I don't mean to downplay somebody operating on your testicles, but it's less of a major surgery.
Sure. And if that works, you're just talking about getting swimmers through without your female partner needing, you know, a full round of IVF. So I understand why people try to do that.
The other thing with vasectomy reversal is if you get the right guy, which you probably should, get a good person, they can retrieve, and they work with an IVF lab, they can grab some sperm while they're there. And
yeah, well, that's right.
Freezer, in case the vasectomy reversal doesn't work, then you have some sperm in the freezer that you can use for IVF.
Right. Which is not possible with a tubal ligation reversal.
Not possible with tubal ligation.
Yeah. So once again, men are a little bit more efficient than the female body is.
Well, they're more simple, shall we say?
Simple. Let's just say that. It's more simple, which leads to efficiencies in reproductive wellness, leading to positive baby outcomes.
But I always say that's because the egg does more work than the sperm. Okay.
I like that. The egg does more work. Okay. It is. I mean, it's the health of the embryo is 80% is the egg's responsibility, correct?
Absolutely.
So yeah, it's not to be taken lightly. So, you know, at the end of the day, these types of dialogue need to happen with the specialist and not just your OBGYN. This is really a conversation to have an IVF specialist.
Yes.
It's highly specialized. If you're considering a tubal reversal, I just encourage everyone to at least do a telemedicine consult with an IVF specialist so you can fully understand what all options are in front of you, because it's not just about the
elective surgery, Alice, you would probably tell people any elective surgery, not an emergency, always can't hurt to get a second opinion, especially with telehealth.
Without a doubt.
Yeah.
And it's all the things have to be taken into account, not just the quality or condition of your tubes as they are. It's also the quality of your uterus. It's your overall fertility parameters, right? Because you need somebody to evaluate, even if you embark on this and do a reversal, is the rest of your reproductive system set up optimally to get an embryo through those tubes?
Right. Like, what if your new partner has terrible sperm and you need IVF
you go anyway? Exactly.
Go through surgery for
right. There's a lot of diagnostic steps is kind of the bottom line. So we're going to wrap up this episode about tubal ligation reversal. I hope this is helpful to everyone who's even considering it. We do get asked this question a lot on the Fertility Answers app. If you have further questions, of course, ask Serena, ask our other experts on the app about tubal ligations in the first place or reversals. We do have male fertility specialists who do cater to men who are seeking a vasectomy reversal. We'll do a whole episode on that as well. And subscribe, like, share us. You know, we're just trying to spread the word and get great educational content out to you. Dr. Serena H. Chen, thank you for joining us today, and we'll see you all next time. I'm your host, Alice Crisci, with Fertility Answers app. It's always so great to see you.
Bye.
Bye.